Welcome, everyone. Welcome to my podcast, Leadership in Medicine. As you know, in this podcast, we discuss all the top leaders from across the world who are making tremendous difference in the lives of individuals from across the world. Today, we have the pleasure of welcoming Dr. Gaurav Deshpande. He is a maxillofacial surgeon and he is a dedicated healthcare professional who has made a significant contribution to the field of cleft care and surgical philanthropy through his work with Operation Smile. Dr. Gaurav has a background in pediatric surgery, maxillofacial surgery, and a passion for serving underserved communities. Please welcome him on our podcast, and he's going to talk about Operation Smile and how he started working as a volunteer, and then how he brought his expertise, knowledge, and compassion to countless surgical missions across the world. Hello, Dr. Gaurav. How are you?
Hi, Amreen. Thank you so much for having me here. It's an honor to be speaking with you and through your channel podcast, reaching hundreds and thousands and millions of people around across the world. So thank you so much for having me here. It's a pleasure and honor for me.
Thank you for being here. So, you have tremendous background and also your compassion is truly inspiring. So, can you talk about your journey? Like, what inspired you to actually join Operation Smile? And prior to that, what inspired you to volunteer as a maxillofacial surgeon?
Well, thank you. That's a great starting question, I guess. I was born in a small town near Mumbai, so not used to the big lifestyle, big city lifestyle. But fortunately, I was able to do residency in Mumbai, which is the biggest country, biggest city in India. Through that, I learned about maxillofacial surgery. Yeah. But unfortunately, in that training program, we did not have I don't want to say much because there was nothing. Did not have any exposure to cleft surgery because most of the cleft surgeries, cleft patients were directed to the plastic surgery department, and we mostly did, trauma and minor oral surgery, major oral surgery, but not cleft surgery. So after I graduated residency, I was an assistant professor at a teaching hospital. I heard about a surgical program that Operation Smile was conducting in a place called Guwahati. It's in the remote northeast part of India. This was 2010, 11. So at that time, that area was particularly a kind of a troubled area, a lot of unrest, conflicts, internal versus external. When I heard about it, I was instantly captivated. One of my senior colleague had gone and, operated with Operation Smile in a previous program, and he was speaking very highly about it.
Right.
So I was curious, it's like, good. And he also told me that's a very international kind of a team. So
Right.
that just made me click saying, well, I can learn a little bit of clefts, which I had not before. And, learn from a diverse kind of experts in the field. So I applied as I said before, I had no experience in cleft, so they were gracious enough to accept me as an observer. And there I met once I was there, I met Dr. Alex Campbell. He is an American board certified plastic surgeon, but he was living in India in Guwahati for a year and a half, just serving people, along with his partner, who also was a plastic surgeon from Colombia.
Right.
So, when I met these two amazing gentlemen, two amazing people, and, just started working with them. I remember Alex asking me how many clips I have done, during the initial conversations. And I was, there was the devil on my left shoulder poking me with the trident, just make up some number. Don't
Right.
tell the truth, but, common sense prevailed. And I told him I've never seen a patient with cleft. He was pretty kind enough to say, well, that's okay. We'll work it out.
Mhm.
Uh, that was the beginning of the journey. I spent a lot of time with Alex, with Carolina, who is his partner, learning clefts, learning about the mission, learning about what Operation Smile is doing. I was pretty new to the organization at that point of time, and by the end of 8 days, I was able to start operating independently because Alex and Carolina are such great teachers. And when you're operating, you usually talk about things, and just got to know more about how things are done here. Was very inspired. There was a huge need in Assam. You know, every time hundreds of cleft patients showed up because there was no care before Operation Smile actually, partnered with the government of Assam. And I remember, at that time I did not have a cell phone, so I went to a local booth and called my wife and told her that this is what I want to do. And she was like, "Are you coming home?" I said, "Yeah, sure." But this is something which I really am inspired now and motivated to do in future. And she supported me, and I packed my bags from Mumbai. My family was surprised and a bit of irritated because they knew about how difficult that area was, and I'm leaving my practice in Mumbai and going to an unknown. But eventually everybody supported, and that was the start of the journey, where I spent 4 years, and the team treated more than 16,000 deaf kids in that 4 years. So it was very impactful.
That is such an inspiring story, and thank you so much for sharing it. But, as a practicing physician, I know that, especially particularly for surgeons, when they graduate and, they start working, mostly the money is a big motivating factor, right? So it's very rare to see individuals who kind of step into a different role. And I think it takes a lot of empathy and compassion. So where did that come from? Like, what was the impetus for making that transition?
I mean, that's a very interesting question, Amreen. And sometimes there are things in life which just happen, and you don't think about 360. Like, well, if I leave, I won't be able to get my practice back, because obviously there is a lot of competition. Luckily that time, it was just me and my wife, and she was working too. So, there was that stability, at least I felt, in her. If things go south, we won't be on the street. So,
Right.
I just followed my motivation, which was, working with this amazing organization, working with these people who I mean, if you imagine, Alex was here from United States, and Carolina, and there was an entire team of people who were staying in India as opposed to highly developed countries. So that was kind of an inspiration. It's like, why can't I move from India, within India, from Mumbai to this place? That helped a little bit, but yeah, I mean, the support from the family was a big kind of uh, you know sup, uh, kind of a thing that helped me make that decision easily.
Definitely. I mean, I think you need to have that sort of support system and a sort of a security blanket, at least in place, either in a form of your spouse or family members, and then you can kind of take that leap of faith. You're absolutely right about that. So, can you tell me a little bit more about Operation Smile? It's a wonderful organization, I know, but in terms of like from the time it was founded to the present, what is the mission, and what inspired its mission? What is the vision? And, talk a little bit
Yeah.
more about the cleft surgery procedures being performed.
Sure. So Operation Smile was founded in the year 1982 by, again, two amazing human beings, Dr. William McGee, who is a craniofacial surgeon here in Virginia Beach, and his wife, Kathleen, we call her Kathy McGee.
Mhm,
She's a nurse by training.
mhm,
Um, so they had heard about, a lot of unoperated cleft children in Philippines. So they formed a small team, and just like to try it out, kind of in a way, they went to Philippines to see like what is the situation, how much help do they need, and how can they contribute. And they were very surprised and astonished to see like hundreds of children show up for this small little program, where they have literally like few resources to operate on a few children. But hundreds of them showed up. Fewer children or fewer adults, never received care before, because there was nothing like that existed. That moved them a lot, and that was the beginning of Operation Smile. And they came back home, they raised more money, and they kept going back. and quickly realized that they need to have a more kind of sustainable solution to this problem. And when they decided to like formalize and form an organization, which is now treated hundreds of thousands of children around the world. Currently, it started in Philippines in 1982. As of today, we are in 38 countries. Uh, when we started, we were a volunteer-based organization. We still are a little bit, where we form a team of comprehensive experts in the field of cleft surgery, and then we take that team with the help of the local foundations. That Operation Smile has a non-federated kind of a system, where the local foundation, they finds the patient, they find the hospital where we can operate, and our team goes and operates. Stays A smaller team stays back for the follow-ups and post-op, and this team is not just surgeons but also dentist and speech therapist and psychologist
Right.
and nutritionist, just to give the entire
Um,
gamut of care to the children. But we quickly realized that this may not be just the only way to help the children in the long run. So now the impetus is very strongly on education and training. The impetus is very strong on strengthening the local healthcare system, so that we train the physicians, we empower them to take care of their own children rather than depending on anybody else.
mhm.
But we make sure that they have the right necessary amount of skills, they have the right resources, so they can do it safely. We all know, the perioperative complication in each country depends on the local, kind of health infrastructure they have. And in certain countries where we do work, that infrastructure is extremely poor. So the complication rate is very high. So
Right.
through our education and training efforts, we want to make sure that we change that. So when the children go on the table, they are operated in a much safer manner. They get, high quality care. So that's the impetus right now. We are supporting the district hospitals. We are supporting them with resources, equipment, with education and training, so that they are fully equipped to make sure that whatever surgery they offer is high quality and very, very safe.
That is a wonderful initiative. And I am just completely awed and inspired by the whole idea that, like, you can actually take a dream of making an impact in disadvantaged communities and actually implement that dream in such a successful way. So thank you for sharing that. I think it's wonderful initiative, and I'm so happy that you're here to talk about it. Can you tell me a little bit more about, like, I know that, the surgery is one aspect of the whole rehabilitation project, right? So, what else can you do to make sure those individuals, particularly, in certain communities, there's a lot of stigma and taboo
Yeah.
associated with cleft palate, especially. Like, there are lots of, like, I've heard some of my, I've worked in a lot of, like, I've worked in South Africa, a lot of African countries, as well as South Asian countries. So, there is this stigma that is almost like, they feel like it's some sort of an occult,
Yeah.
practice, or they
Mhm.
label children who have a cleft palate. They're bullied in school. So is there like a holistic sort of a program that addresses
Yeah.
those?
Yeah, absolutely. Very good question, Amreen. And when I was in India and operating on these children, I have heard hundreds of stories which are very, very touching. There was a kid who had complex facial cleft, and he had no friends. He barely went to school, and they called him the ghost of the town.
Right,
Whenever he walked around the town, and simple surgery just changed that completely. And when I saw him in follow up, like he was extremely happy.
right,
You can immediately see he's more open, he's lit up, he's not conservative now in himself. um but that's the kind of impact that surgery has. And as you said, there is a lot of taboo associated with it. People say, you probably have done something bad in your past life, or
yes.
you're a devil. Like, there are hundreds of different kind of stories of that, depending on where you are on the planet. So a big kind of our effort is in community training education as well. Just community awareness is that, this is very common kind of a problem happens in every one child out of 800 that are born. It's nothing to do with the mom, nothing, absolutely not to blame the mother, not to blame the father or anybody else. It's
Right.
just the way, the body is formed, and sometimes things don't go the way we expect it to. So, a lot of effort goes into that community kind of awareness. We do like screening camps where again, we present to the people in the language that they understand, with the help of the local leaders. Just this is like, what are the reasons? Why is a cleft form? It's easily treatable, so don't worry. These people, these children can become like a normal, citizen of their community. So all those things are done very meticulously along with nutrition, because most of the times these babies are malnourished. So the nutrition program, along with the community awareness with videos, which are very relatable to these people,
Right.
are done in the countries that we serve. Then we also have those consultations, with the medical team, so that the parents who have absolutely no clue what's happening, and how did this
Yes.
happen? Because in
Yeah.
most countries, in developed countries, you are able to find out if there
Yeah.
is a congenital difference in the USG, in the ultrasound, prenatal ultrasound, right? But most of these parents, they do not have that luxury to have an ultrasound before the child is born. So you can imagine it's a big shock for,
Yeah.
the entire family. Um, so, just a good counseling is very important for them, which, we take it very seriously. And then we just plan out the entire process for them, what to expect at what age, because cleft surgery is not like, you can do one
Yeah.
completely fix the child in one go. We usually time it out in different stages. So, good explanation about it is very important. So just the knowledge that, the parents have helps a lot in terms of the outcomes as well. When the parents are aware of like, okay, my child has undergone surgery, what are the post-op things like after the surgery I need to do or don't do? And you can see the involvement, they are involved. There is some kind of guilt which they have at the back of their mind, which,
Yeah.
we need to make sure that is gone by
Yeah.
the way of getting them more involved in taking care of their child. And that just, vanishes by the time you see them after 6 months or a year, where they are so involved and they're talking to the neighbors and, in the communities. If there is anybody who's born with similar kind of, issue, they immediately refer, and they are now the kind of the advisors to them. So that's like a great tool for community engagement as well, which is extremely effective.
Right. You're absolutely right. I think the community buy-in I've seen even with my own projects. I haven't worked in obviously maxillofacial, but I have worked with women of domestic violence and abuse in certain disadvantaged communities who I worked with a plastic surgeon who was performing facial surgeries on women of burn victims of domestic violence and abuse. So you're right, like community buy-in and just creating that advocacy and not blaming the victim or the survivor, like not in this case, not blaming the families of those kids or blaming the kids is the key, I think, in creating that sort of change that we're looking for. Absolutely. Another thing that I wanted to ask, like, what are some of the key priorities and initiatives for Operation Smile in terms of like the next few years? Like, it seems like a brilliant idea, and I'm sure it's like helping a lot of people. I'm sure you wake up every day feeling like you're making this big impact. I think as physicians, there's nothing more comforting, at least, for me. Like you wake up in the morning and you feel, oh my God, I'm making an impact in someone's, like you're actually directly making an impact. So how does that feel? And like, where do you see yourself in the coming years? And what are your plans for the future?
Yeah, I mean, to be honest, when I moved to the US to pursue master's in business administration, I had not like really thought that I'll be having this opportunity to work for Operation Smile. The stars just lined up, And here I am in Virginia Beach working for them. It's almost 2 years now, working in this role. I mean, obviously, I was operating. I was a volunteer. I was
Right.
managing a center in Mumbai, and then Guwahati before that with them. But never thought that I would be able to work at the headquarters. And actually, it's life transforming for me, because
Yes.
that time I was able to operate a child, one smile at a time. But here in this role, I'm able to impact thousands of children at one moment. So this is extremely kind of motivating for me.
Right.
In terms of the next phase for the organization, as I said, the impetus is now heavily on education and training,
Right.
not just of surgeons, but anesthesia, pediatrics, nursing, oral health, psychosocial, speech therapists. So,
Yes.
how can we use the local kind of infrastructure or resources and upskill them, even human resource, right? Speech therapy, we have found out like it's very challenging to find in every country.
Yes. Yes.
And then you find speech therapy who are trained in cleft is almost, in certain countries impossible to get. There are probably one or two in the entire country who do
Right.
that work. So how can we, task shift? Like, is there any other kind of profession whom we can give the basic kind of support to, so that they can take care of, certain kind
Right.
of basic aspects of speech in cleft surgery. So education and training is the core of the organization right now. Everything is working around it. We are also, as I mentioned before, we are trying to strengthen the local health system. So we
Mm.
are working with district hospitals. It's like a hub and spoke model. The hub is a tertiary, high acuity
Right.
teaching hospital, which we
Okay.
then connect with the spokes, which are going to be the district hospitals. So hub and spoke models. um, what are the needs in the district hospitals? Many times the place is not well maintained, because of obvious reasons, and nobody to be blamed. It's just not on the radar of the government sometimes. So
Yes.
how can we come in and just make the place a little lively by just doing a white paint campaign, or supporting them with some critical equipment like anesthesia machines, like better lights in the operating room. How can we do, the wards a little more welcoming for the patients? This is pediatric patients, so it should be colorful, vibrant, and it should not be like a sad place. So, how can we help in making that place this magical place where the kids who get operated, they get, obviously, again, I keep saying this, high quality, high safe, very safe surgeries, but also like, something that it's not like a bad event for them, but something that, they can cherish as they grow with their parents. So that's the core of the organization right now. It's just like, how can we come in, not to take care of your children, but how can we come in and, you know, give you
Yeah.
whatever you need so that you can do that, rather than depending on anybody else on the outside. And you can imagine is that just does not stop at cleft surgery, because
Yes.
when you give a new anesthesia machine, better monitors, better
Yes.
wards, even if they're not operating clefts, they're using that for other essential surgeries, which again just exponentially increases the safety quotient of that, which is very important.
That is amazing. I know this kind of like reminds me of the broken window theory. I don't know, if you're familiar with that. Like you just fix a broken window and the rest of the sort of infrastructure impacts
Yeah.
how people start behaving, acting, and kind of modifies the community as a whole. So this
Yeah.
kind of like plays into that and reminds me of that. But thank you for sharing this. Also, like, what do you feel would be some of the policy concerns in the broader healthcare systems that you feel could help in moving this project forward, or even implementing similar projects in future?
Yeah, so Operation Smile has a well-established policy and advocacy department, and it's led by one of my mentor, Dr. Ruben Ayala. He started in the organization as a student volunteer himself in Panama, and now he's come along so much, and he is heavily involved in the policy advocacy kind of work that the organization is doing. Last year, I was able to represent Operation Smile at the United Nations, where we had a side meeting about the congenital. Um, they call it anomalies. We are trying very hard to change that terminology to differences. It's just
Okay.
very hard to. It's very harsh on our ears, right? When you say anomalies. So but it was sponsored by the Malaysian health ministry, and there were like-minded organization in the room, and we were discussing the challenges. Ruben and his team, they work with the governments, the federal and the state kind of health ministries. In many countries, we are actually helping the government to form the national surgical obstetric anesthesia plans, and so because we have noticed that many countries, the ratio of physician to the population is extremely low than
Yeah.
what the WHO recommends. So working at that high level just helps us to get that broader kind of impact. Which, I mean, obviously you can keep working on the ground, but when the Ministry of Health is on your side, then things just become simpler.
Yeah.
And the policy and advocacy team at OpSmile is really making that difference. They are hosting a big conference in May in Ecuador with the Latin American kind of policy advocacy chapter, and then they're going to present, in Geneva their findings later that month. So lots of work with the governments, with the ministries, just to um, not just advocate about clefts, but advocate about essential surgery in general, and getting them on our side so that, when we are trying to implement some infrastructure changes, the government obviously has the connections and also the resources to help us implement that. So yes, we are very active in that space as well.
That is so amazing. I think you're making such an impact on a broader scale, not just like, restricted to certain surgical procedures, but like actually changing the whole dynamic of how we view cleft palate and surgeries in general. And just like, in terms of like community impact, I'm sure it's creating a lot of ripples across the world. Well, thank you so much, Dr. Gaurav, for taking time out. I am really in awe of all your work that you're doing. And thank you for being on my podcast. It was an absolute pleasure.
Thank you so much for having me, and it's a pleasure and, as I said, honor for me to be sharing my thoughts. And I'm happy if there are any follow-up questions, if anybody has, happy to answer them. Thank you so
Sure.
much.
I will leave the links in the comment section, and people can like access Operation Smiles mission and also look up your profile. And if they have any questions, they'll reach out to you.
Thank you so much. That'll be great. All right. Thank you so much.
Take care.